Good evening again, everyone, and welcome to our MES Masters segment. Tonight we're going to continue on with the session we did topic we had last session, excuse me, and we talked about Mrs. Jacobs. Well, Mrs. Jacobs is here with us tonight. A younger version of Mrs. Jacobs is here with us tonight. And we're doing this so that you can now have a better grasp of, number one, how to manage your clients, how to pull out the important things in their history and in the discussion and in your assessment. So now you can start making better decisions in managing the clients. She is a 79-year-old female referred for a left total hip replacement, okay? That left total hip replacement was done 4 months ago. It was a cemented anterior approach. So if the surgeon is actually doing this surgical procedure, he or she's gonna come in this way, and they're gonna actually cut these ligament structures so they can now access that hip joint and actually pop that femoral head out. And they're gonna actually be able to dislocate the hip, get the femoral head out, if I can get this one out, and then they're gonna actually take off this femoral head. They're gonna go in and do the surgical repair, or the surgical replacement, I should say, and then they're gonna actually suture everything back together, and this new femoral head is gonna look something like this. There it is right there. There's our new femoral head. That's what our new acetabulum looks like, and it pops right in. She gets short of breath after 15 to 20 minutes. She has no hip pain. She's had the replacement. She has no hip pain now, and she has knee pain at the level of a 5. That knee pain is from that old arthroscopy back in '87 and the PFS as a result of never developing that quadricep enough. What we've done is we've cut off the femoral neck, drilled down into the shaft of the femur, put a new implant in, so she can still flex and extend and do everything, but she doesn't have any limitations because hers is an anterior approach. Please. The MET assessment forms aren't like the fitness assessment forms you're used to, which are pretty truncated or pretty minimal. You now have to look at more things when you're dealing with a medical exercise training client, and even more so if you're ever going to deal with an insurance company or doctors or therapists or chiropractors down the road. This functional assessment scale now gives you the ability to get a snapshot of the client's functional capability. Whenever you want to do the assessment, it gives you a point value to now show you, let's say the client started out with a 8 on day 1, and 30 days later, so day 31, you test the client again, and guess what? They were 8 before, now they're 16. Improvement? Yes. And I guarantee you down the road, insurance carriers are going to start looking at things like that. Now, of course, I will have the gait belt on her, holding the gait belt, just to make sure, because you are going to get clients that are more challenging. Probably back in 2017, you got clients that had gone through rehab, had a hip replacement. They had outpatient physical therapy. They had inpatient physical therapy. And go ahead and have a seat there for me, Ms. Jacobs. Thank you. They had all the therapies. Guess what? Life has changed. Now we're seeing more and more clients that are coming out of rehab earlier, which means now you have to be a little bit more creative. You have to know a little bit more about managing these clients a little bit earlier. And that's why we put this MES Masters program together, so you can have a better idea. Good. Okay. Can you roll back for me, please? Now, rolling. That takes trunk control, hip control, and to some degree lower extremity strength. And we're going to ask her to bring her knee to her chest. And as she brings her knee to her chest, I'm going to readjust everything because I got to move. And guess what? Now the value that we see here on the goniometer should be her range of motion value. Lift your leg. And what we're going to do is realign everything so that we're finding that lateral condyle there. And her range of motion there is, actually it was about 15 degrees. And take it out to the side, right there. And now she's at, looks about at 30 degrees. This is our MedX Pro network. If you haven't had a chance to look around in there since you joined the MES Masters, please do. And once you get into the network, we got all kind of great things that are in there. Probably one of the biggest things is the professional resources that we've set up for you. If you're looking on the left side of the screen here, you'll see we got professional resources. There's one there that says goniometry. Click that goniometry one, and it's going to take you to the goniometry section, and it's got range of motion values for the cervical spine, the wrist, the ankle, the knee, the hip, and there's hip extension. There we go. It opens up, and it's going to play the hip extension video. It's got the step-by-step process here. If she can complete the range of motion against gravity, that's considered fair. If I can give her a little bit of resistance, that's considered good. And if I can give her 10 pounds of resistance, that's considered to be normal. We're going to now apply resistance down through her heel and ask her to hold. Now, dermatome is an area of skin. Derma is a Latin word that means skin, tone means cut. So it's an area of skin that's innervated by a particular nerve. We also have myotomes. Myotomes are muscles that are innervated by a particular nerve. Numbness and tingling in L3 area, along with the weakness in L3 tells me what? There's a nerve and a muscle problem. The only explanation for that would be what? Some type of nerve root issue. Real quickly, we're going to show you a couple things with special testing for the hip. And there are three we're going to show you. Faber test. This test is going to tell us if we have early stage arthritis or a tight hip capsule. The Thomas test, which we're not going to do for Mrs. Jacobs, but we need to understand the Thomas test is going to give us an idea of the flexibility of four muscles in the lower extremity. The rectus, the psoas, the sartorius, as well as the rectus femoris, okay? So it's going to allow us to look at four different muscles, and then the Ober test is going to give us an idea of the flexibility of the IT band. If you have one leg that's way up here, okay, and then the other leg is way down here, it's telling us that that hip capsule on that side is tight, and a tight hip capsule probably 60 to 70% of the time is a precursor to early stage arthritis. Now, what we should see here is that this leg is parallel to the floor or below. That tells us that our psoas is flexible. What we should also see here is that the knee here is at least 90 degrees. Relax your leg there for me. We want to see that knee at 90 degrees. This is telling us her rectus femoris is tight. And look what we're going to do. Take this leg behind her and just drop it. Now, what we should see is that leg is able to drop down to the table or below. If that leg is sitting up here, we got a tight IT band. Well, so our precautions are avoid anything that causes her more knee pain. The hip is going to be fine as long as we just keep progressing her, and make sure that as we're training her, she's taking her blood pressure medication. As we strengthen her, congestive heart failure won't go away, but what we should see with the congestive heart failure is her endurance gradually improves. And then lastly, the plan is with this progression, what the progression will look like, what will be the next level activities that you can do with the client. And for the most part, if you incrementally progress the client and give them more challenging exercises, they're going to get better. So here's your homework assignment. What I'd like for you to do is look at Mrs. Jacobs, a fictitious Mrs. Jacobs, okay? And what I'd like for you to do is develop the exercise program for Mrs. Jacobs for week 1, and then develop the exercise program for her in week 4, and then develop the exercise program for her in week 7. Okay, so 1, 4, 7. Showing the progression that you would do with her along the way. Now, she has no complications. She should do very well. She should be your bread and butter type of client. And when she gets to the point where she's fully functional, you can step her down to personal training and keep working with her, but you may not have to do all the stuff you do with medical exercise training. Thank you for joining us, and we'll see you in 2 weeks. Take care.